And my name is Stephanie, and we'll be your morning's opening session. We'll explain a little bit about ourselves in a moment, but we really want to give a shout out to the fact there are over 46 countries represented in this room right now. I heard we have about 500 persons joining online, so we have a very, very wide audience today. Every session will also be recorded and shared online after this meeting, after the event as well. This is actually a remarkable global representation of the mental health space that we have. And we have organizations working across the global mental health space to make an impact. And we're looking forward to learning more about your work, the work we're doing together, and the best practices across our countries. Before we get started, we just need to go through some logistical and safety information before we fully get started on today's proceedings. As you can see, there are exits there and there. In case of emergency, please be sure to follow the emergency procedures by the center. In case of a fire, use the stairs instead of the elevator or escalators. There is Wi-Fi available. The password is on the screen. You can see CC. There is also two floors that we will be doing our conference today. This is the main floor where there will be the plenary, but then upstairs will be where all of the breakout rooms. There are via the stairs, the elevators, or the escalators that are right at the front where we did the registration. The bathrooms are located just beyond the escalators through the glass doors on the right-hand side as well. Now that I've gone through the logistical information, we want you to be very active on social media over the next few days. And we want everyone to be as loud and as vocal as they can. Be sure to use the hashtag GMAN2023, so that is GMHAN 2023, and post on all social media platforms, whether it be Instagram, Twitter, LinkedIn, TikTok, everything, and be sure to tag the newly refreshed GMAN Insta on Instagram as well, and United for Global Mental Health on Twitter. Throughout today's event, we'll be joined by a very special experience run by the South African Depression and Anxiety Group called the Human Library. Now, Ives, would you please tell me more about this group?
Certainly, Steph. So, the Human Library is based on the commonly used idiom, do not judge a book by its cover. So, relating this back to mental health, they use wisdom to conceptualize those living with or impacted with mental health issues as books, who can then share their own unique lived experience to help put a voice and a story to an issue. This aligns with SADAG's desire to always give people a voice, to empower them that their story matters. By getting real people to share their real stories, they hope to engage you all and share journey and share the compassion, the empathy, and a deeper understanding of these patient journey and experiences. They have invited different stories to share their experience of living with a mental health issue, be it depression, bipolar disorder, among others, and those who engage with mental health care users or service users, such as the support group leaders. The library is a diverse mix of color, of gender, of race, and backgrounds, making it truly reflective of South Africa's population. Please come and visit the library during the breaks and connect with some of our incredible books. And you may view this special exhibit along the hallways just outside this room. And please feel free to speak with people with lived experience, because it is only by talking to each other and sharing our experiences that we share true understanding and break down the stigma and barriers.
Thank you so much for explaining what the Human Library is. I will encourage everyone to please take time today or tomorrow to visit the Human Library that's right at Dean Arena as you step out to the left of this room. Now, we've been talking for a while, and we haven't actually introduced ourselves. So my name is Stephanie Whiteman. I am a public health researcher, but more importantly for this event, I am a youth advocate focusing mainly on child and youth mental health. And with me, I have Ives.
Sure. Mabuhay. We say it in Philippine language. It means long live, everyone. I'm Ives, all the way from Manila, Philippines. It's a 23-hour flight all the way here to Cape Town, but it's all worth it. I come also from my own local organization before joining United called #MentalHealthPH, and one of my co-founders is here, Roy. Hi. And we started out as 5 co-founders, and we were able to grow it after 7 years into 140,000 members, with 80% coming from the youth sector. So I'm so glad to be here, and actually I just celebrated my first work anniversary with United yesterday.
Awesome.
At this point, we want to hear some more introductions from our participants. You know, all of you had a fair share of traveling here, and we want to hear more from you. So our amazing colleagues at the back, Ali and Sally, have some microphones to pass on around. And when introducing yourselves, please, we're more than happy to know who you are, which organization you come from, which country actually you also come from, and why you're excited to be here in the next 2 days. Is it okay? So anyone who wants to volunteer first? Don't be shy. We have here.
Good morning, everyone. My name is Benjamin Bada. I'm from Liberia, and I work for, anyway, I'm a school teacher, a government school teacher, and I'm also the General Secretary for Cultivation for Users Hope. Cultivation for Users Hope is a service users movement. That means we are persons with lived experience. We suffer mental health ourselves, so we want to take the bull by the horn. So we ourselves are championing the advocacy in CFUH to make sure that we end this stigma on persons with psychosocial disabilities. So we suffer it ourselves, so we don't want any other human being to suffer mental health. Mental health is like you are in a hell. So that's what we do in Liberia. Thank you.
Okay. So we have in the back. Yeah.
There first.
So my name is Deborah Diedrichs. I'm from Cape Town, so from a Cape Townian, I would like to welcome you all to my city. I'm sorry you're here in winter. It's usually more pretty. So I work for Empower. We're a global foundation. We work in 15 different countries. In South Africa, we focus on mental health, and I'm surrounded by people that we fund here, which I'm very happy to see. And I wish you a really great conference.
Hi, good morning. This is Harun. I'm from Bangladesh. I'm working with ADD International. ADD is Action for Disability and Development. It's a UK-based charity organization, and I'm working in Bangladesh chapter. We have some program in Asian countries and as well as African countries. We are working on actually on community-based mental health for children and young people at the grassroots area and as well as in the climate and disaster-prone areas in Bangladesh. And I'm excited to be here that I would like to take away something from you all. Yeah, that's experiences. That's experiences for our mental health program development, as well as we are working with the government for actually policy formation, policy reformation, and policy implication. So we have scarce in service providers, professional service providers in our country. So we have, I have the opportunity to learn from you, from your experiences. Thank you.
Thank you. We have time for about 1 to 2 more, so we'll just take this one and here.
Okay, good morning. My name is Daniel Rivera. I'm from Lima, Peru. I'm part of Alamo, Promotion of Mental Health. And my expectation here is to build a really strong network working with and for people with mental disabilities, mental health. Thank you.
Thank you for joining us today.
Good morning, everyone.
Morning.
My name is Edwin from Kenya, Nairobi, Kenya. I am the founder of Mentally Unsilenced. an organization that deals with one of the biggest things that people face in mental health is stigma. Very passionate about it. I expect to network. I expect to learn. I'm also a person with lived experience, so I will definitely visit the Human Library because I am a very serious book. But one of the things I want to talk about, want to leave with you is something that I've always said in terms, when it comes to stigma is, when I keep quiet, stigma wins, and I cannot let that happen. So whatever we do, never, ever, ever keep quiet in the face of stigma. You keep quiet, stigma wins, and we can't let that happen. Thank you.
Lovely, wow. This room is full of energy and experience and wisdom.
Yes, and I can see just from those 5 persons that introduced themselves, we have about 3 or 4 continents. We had Latin America, we had Africa, we had the Asian continent, all over. So that's just to show the vast, wide range of persons that we have with us today.
Yes, and we also wanted to say hi and greet all our virtual participants joining us today as well. Please feel free to greet each other in Zoom. Thank you very much for joining us today.
We also want to say a very special thank you to the funders that make this event possible. So special thank you to Wellcome Trust, Koroko, and the Vital Foundation. Can we please give them a round of applause? Because without them, we won't be here in this room.
And not to mention our sponsors who support the Action Network all year round. We say our thank you to Lululemon, the Comic Relief, Pinterest, Adobe Foundation, Grand Challenges Canada, and Foundation Botnar. A round of applause, please. We are very much grateful for your continued support. And mind you, Steph, with that amount of support, we are pleased to announce that the Action Network has officially reached, drumroll please, 3,000 members from 135 countries. Give yourself a round of applause. But what does GMAN stand for, and what is it for, Stephanie?
So thanks for asking. So we've been using this acronym GMAN so long, the GMHAN. What does that mean? So that's the Global Mental Health Action Network. And what that is, it is a network of campaigners, advocates, professionals within the global mental health space from around the world that aim to create a supporting, aim to create a network, that aim to support and give resources and a space we need in order to get the change that we want in reality. The GMAN community is a wide range of actors across 135 countries, as Ives would have mentioned, and this includes advocates with persons, including those with lived experience, or should I say experts with lived experience.
Amen.
UN agencies such as the WHO and UNICEF, civil society organizations, youth, academia, and the private sector. The majority of our countries represents low and middle income countries, but we also have representation from some high income countries, as well as small island developing states like Barbados, where I'm from.
That is fab, Steph. United for Global Mental Health founded GMAN with a range of partners who were committed to building an advocacy movement for mental health. Today, United GMH acts as the secretariat of the network with an advisory group composed of our wonderful GMAN members from all around the world. It is with great pride that we share that we now have 5 active working groups, and we will be launching a brand new group tomorrow. As a network, our achievements so far include the advocacy efforts of our different working groups that have ensured significant progress in their respective areas of mental health.
In addition, the Universal Health Coverage Working Group has developed a set of key tasks from the global mental health community for the United Nations high-level meeting on universal health coverage in September 2023. And we are pleased to report that the draft outcome document for this high-level meeting contains very strong language on mental health.
Key win.
This is in part for the incredible advocacy from members of the Suicide Decriminalization Working Group in Ghana, Malaysia, and Pakistan. And these countries, along with Guyana, have decriminalized suicide in the past 8 months.
Wow, and aside from these global and national level works, I wonder who has ever here joined the Mental Health for All webinar? Great, because that's one of our key achievements. Our webinar series attracts hundreds of members on a monthly basis to discuss important issues within mental health, and we now have run 58 webinars with over 3,000 members joining us over the last year. We now run these regular knowledge exchange sessions.
And it's good to note that these sessions are run every single month. So every single month there is a Mental Health for All webinar. As a young person myself, the Child and Youth Working Group has ensured that youth participation and the voices of youth with lived experience are at the forefront of the mental health conversation, and have partnered with the Financing Working Group to ensure that the investment case for youth mental health was also highlighted throughout the launch of this initiative last year.
Yes, and the work of our working groups continues to develop, and we are so happy to have you all today hear this journey with us. And thank you so much for your continued contributions to our community. So, Steph, what are we expecting for the next 2 days?
All right, everyone, so hold tight. Over the next 2 days, we'll be running 18 sessions. Yes, 18, we're going to be packed.
Wow.
And we're going to cover 5 themes. So the first one will be the future of mental health, and this includes sub-themes such as youth mental health financing, and universal health coverage. We'll also be covering the crises affecting mental health, which includes climate-related disasters and ongoing environmental degradation. We'll be talking about research and data for advocacy. As a researcher myself, I'm very keen for this session, I must say. And for these sessions, we will explore the challenges and the best practices emerging within different contexts, and how we can best use data and a multi-sectoral approach as we inform our advocacy. We'll also be talking about preventing suicide and the decriminalization of suicide. And then our last theme would be focusing on stigma and discrimination.
Wow, they have so much to choose from, Steph. We would now like to welcome some other participants, so less of us, more of others, to the stage to share their insights and perspectives on these important issues within mental health. And most importantly, what the crucial opportunities for action are over the next year and beyond. Steph and I will introduce each speaker, and please feel free to join us up on stage once your name is called. First off, we have Mark van Ommeren from the World Health Organization. So Mark is the head of the mental health unit within the Department of Mental Health Substance Use in WHO in Geneva. Mark has been involved in a wide range of mental health activities, including in humanitarian policy, assessment, epidemiology, guidelines, medicine, psychological interventions, and country support. Recently, he coordinated the writing of WHO's World Mental Health Report. Welcome, Mark.
Now I would like to call up Sandra Fiara from the Global Mental Health Peer Network. Thank you, Sandra. So Sandra is the regional representative for the Global Mental Health Peer Network, and what that is, it's an international organization that builds capacity among people with lived experience of mental health condition throughout empowerment, mentorship, and support. As an international organization run for and by persons with lived experience, they hold a wealth of expertise and power in diversity among persons with lived experience as representatives. They develop a global lived experience leadership in mental health and provide sophisticated communication and engagement for persons with lived experience and diverse backgrounds. So welcome, Sandra.
We also have Juliana Fleury from AESC Brazil and our GMAN Advisory Group representative for the Americas. Welcome, Juliana. She became president and volunteer CEO in 2018 with ASEC Plus as a CEO based in Sao Paulo, Brazil, working nationally, and since 2004 to implement evidence-based children and youth mental health skills for life programs. More than 400,000 people actually benefited from this program. Thank you very much. And ASEC Plus is one of the 30 countries connected to Partnership for Children, a UK-based small charity that acts globally and benefits more than 2 million children and adolescents. Welcome, Juliana.
And joining us online, we have Aman Nisser from Changemakers Afghanistan. So Aman will be joining us online, so as soon as tech brings him up, he will be joining us. But Aman is the founder of Changemaker, which is an initiative that pursues the narrative of mental health and emerges the links with other sustainable developmental goals. His major commitment to advocacy comes through his initiative, where he runs a cluster of community-based initiatives and activities specifically focusing on sustainable developmental goals 4, 5, and 13 with a mental health lens. He says his complex, conflict-stricken, and diverse background enriches his perspective to be informed and needs for vulnerable populations. And there we have Aman. Can we please give him a round of applause?
Lovely. Welcome. And last but definitely not the least, we'd like to invite Margianta Suraman Johanda Dinata from Emancipate Indonesia and Being Youth Representative. So since 2010, Margianta's experience ranges from grassroots work to high-level advocacy in regional and international network with intersectional focus on youth development, global health, and social justice in low to middle-income countries. Margianta is part of the CSO Advisory Board for UN in Indonesia and the youngest council member of the Being Initiative that funds research innovations to support mental well-being of young people across LMICs. Coming up on stage, Margianta, and we thank our panelists for joining us today.
Now that we have all of our panelists with us,
Maybe
I think
we
we
could
can
sit down
jump straight into. So let me just come on. So for this session, this plenary, we're going to have more of a fireside chat just to get more about this work that you've been doing and your perspectives within the global mental health space. So I want to jump straight into the questions, and I want to turn to you, Mark, first. The World Health Assembly took place in Geneva last month, and a range of mental health issues were discussed. What are the big mental health challenges we face today, and how can GMAN members help address them?
Thank you very much. You can all hear me?
Yes.
So, first of all, I'm very pleased to be here. You would normally have had my director here, Deborah Kessel, but she's organizing a big forum on substance use today in Geneva, so she couldn't make it. So I'm here, and I'm pleased to be here with you. At the World Health Assembly, which is WHO's governing body for all the member states, attend every year, the governments. And many member states made many positive comments about what's about the focus on WHO. So they said some nice comments about the work we did at WHO and the World Mental Health Report. But then they emphasized many gaps that are in the world and they emphasized particularly that millions of people around the world currently do not have access to good enough community-based services. They emphasized, as you would expect, the importance of universal health coverage, and particular primary health care. They expressed concern for young people, particularly after the COVID pandemic. They emphasized the important place of the perspective of people with lived experience. And they drew attention quite a bit to the Ukraine conflict. They expressed that it's absolutely imperative that we continue to prioritize mental health nationally and globally. There's a lot of goodwill and good political commitment at member state level for mental health. In terms of the challenges, there's always technical challenges. We're going to have better documents, more cost-effective approaches, and all that. But let me not focus on that. The challenges that I think we have are twofold, and both are something we can achieve to address. One of them is that is to make sure that the movements, the advocacy for mental health is equally strong around the world. What we see now is that perhaps it's stronger in countries where, Commonwealth countries with a strong English language culture, compared to non-Commonwealth countries. So that is a challenge, but it's also a challenge to be addressed. The second challenge is that at times, perhaps as a field, we don't come across united enough. So I really like the name of United for Global Mental Health, because that is what we should be if we want to have effective advocacy. Now, one cannot expect that we all agree on the same thing. It's normal to have disagreements, different viewpoints. But when we communicate it to the outside world and we all advocate for something different or argue with each other a lot publicly, that's okay. But at the same time, from an advocacy perspective, we don't come across united. So we have different views about some, not huge different views, but there can be differences in emphasis on socially turbulent, treatment, drugs, no drugs. What do you call the difficulties that we are addressing? Psychosocial disabilities, mental health conditions, mental disorders. There's a variety of these, and sometimes we don't come across united enough. And that's why I really like the name of the organization United for Global Mental Health. I think it's important to keep the advocacy levels advocacy messages at a level that we all agree with. So in the World Mental Health Report, we emphasize 3 messages. The first one is to improve commitment and value for mental health, which is true for all. Secondly, to improve the environment for mental health. That means safe services, but also deals with the environment of more distal, like climate change. And the third, to improve our services. So those are my comments on your question. Thank you very much.
Thank you very much, Mark, and for sharing these insightful challenges and suggestions moving forward. We now go with Sandra. So Sandra, as someone who's coming from a community that's run by persons with lived experience, could you kindly share with us what role does stigma play in mental health globally and any strategies that have been successful in combating these stigma?
Thank you. Thank you to everyone in the room. I'm delighted to be here, and anyone joining online. I can't see you, but I feel you here in spirit. Thank you also to the Global Mental Health Action Network for hosting this fantastic event. I'm really excited to see what unfolds over the next couple of days. I think the networking, the sharing of experiences and value is going to be invaluable at the end of the day. All right, when it comes to stigma, so when the conversation is around mental health, stigma often goes hand in hand with mental health. And the reason for this, as many of us are aware, is that stigma is often more detrimental than an actual mental health diagnosis itself. First and foremost, stigma is a human rights violation that leads to exclusion and discrimination. In terms of dignity, it prevents people with mental health conditions seeking help when they need it. It also affects employment opportunities and opportunities for further education. The Global Mental Health Peer Network was one of the first co-authors on the Lancet Commission on Ending Stigma and Discrimination that was published last year in October 2022 and launched as well last year. Within this commission, 4 different definitions of stigma were identified. Firstly, self-stigma, stigma by association, public stigma, and structural stigma. As someone with lived experience, I feel that self-stigma is often a direct cause of the other 3, especially when you're first diagnosed. And it's important at the beginning of the diagnosis journey to be treated, respected, and understood. Having said that, however, I do think it's equally important as someone with lived experience to learn as much as you possibly can about your condition. I am a believer in mottos and sayings and things like that, and one of my favorite ones is knowledge is power. You need to learn about your condition so that you have power over it and it doesn't have power over you. It's very important. Looking at structural stigma within our systems globally, there are many things around the world that can raise an eyebrow, and things like in certain countries, a person with a mental health condition cannot buy property, cannot get married, cannot even vote. In a South African context, it's still promulgated in the Electoral Act that someone who is mentally disordered is prohibited from registering to vote. I know it's something that Charlene, who is the CEO of our network, has been pushing for years. It is obviously very important to recognize these things, but not individually, but collectively as well. I think it is something that resonates with all of us, is the collaboration and the collective appeal to everything is incredibly important. To address the second part of the question and what is effective when combating stigma, research and evidence has shown that the impact of lived experience is incredibly important. For many years, lived experience has been seen as a research subject. And finally, we're starting to see the wheels turn where we're actually active participants and regarded as co-researchers to a large extent. We still have a lot to do. It's really, as I say, it's beginning. But also important to note here, again, we can't do it on our own, and lived experience also needs to be a supported role. So just to, what's the word? I've lost the word, sorry. Just give me a second. Just to elaborate more on the impact of lived experience from an organizational perspective, the Global Mental Health Peer Network is quite a new organization. It's only been around for just over 4 to 5 years. And between the time of March 2022 to March 2023, we've actively been engaged in over 22 service packages, attended 6 international conferences, and contributed to many important publications online that are used within mental health. To end, I think I know one of my favorite African philosophies is the philosophy of Ubuntu. And it's a beautiful, beautiful philosophy that is a belief that I am because we are. And I think within that lies the strength of care. And that is where we can all be accepted, tolerated, and most importantly, where we can all prosper and eliminate this stigma. All right, thank you so much.
Thank you so much, Sandra. And I think it's really important of the point you mentioned that when we're advocating for mental health, we do address stigma in all its forms. And sometimes we use stigma as an umbrella term, but there are very nuances. And when we're channeling our advocacy messages, we have to ensure that we are addressing all forms of stigma as well. So very salient points. As an advocate myself, I have first-hand knowledge on some of the challenges that we face as advocates, raising our voice, especially in big spaces, to decision makers, to the general public. But I want to hear from a man who's joining us online. Is he there online with us? Yes. Great. Can you hear us?
Yes, I can hear you.
Awesome. So, as an advocate, and a powerful one at that, I might say, what are some of the barriers you have encountered in advocating for improved mental health services for young people, and how have you overcome these?
Thank you so much for your question, and hi everyone. I wish I could join you all in person. So to answer your question, I come from a culturally traditional land that has been shaped by decades of war, instability, and turbulence on the flip side, and years of resistance, tolerance, and power on the other side. Our experiences have mostly been formed by violence and trauma, which in itself speaks on how desperately mental health services have always been needed in Afghanistan, which is my homeland. My context is one of the most complex ones to advocate for mental health, since on one hand there are hundreds of issues that needs to integrate mental health support as a response mechanism, but on the other hand, advocates are denied their right to raise their voice. I started advocating in 2019 when the political landscape was different compared to how it is now. And barriers to mental health have increased since then, but the steps that must be taken to address them haven't. Since major issues like the recent humanitarian crisis have been part of Afghanistan's history for a long time, decision makers use it as a justification to ignore investing in mental health. But by analyzing these problems like poverty and hunger, we can notice a crystal clear link between them and mental health. Not just from my advocacy experience of surveying this firsthand, but also from the mental health report which was launched by the World Health Organization, we understand that there is an interconnection between mental health and all the SDGs, which makes it impossible to speak about any issue and concentrate towards its impact on our mental health. A more profound barrier for me is the decision makers' lack of knowledge, which requires extensive training and collaborative efforts to put mental health knowledge and service provision at the top of their agenda. And even highly established donor organizations that are coordinating in Afghanistan, they neglect mental health support from their humanitarian assistance programs. The impact of neglecting these needs are doubly embedded on vulnerable populations since they face additional challenges like discrimination. And during such times, mental health services becomes a priority over anything else. To be a witness of such stories, I'm grateful because I can reflect on their experiences here, but I'm disappointed because there's little that we're doing. And on the other hand, there is intense misconception about what mental health actually is, engulfed with various myths and unjustifiable stigma, at least from where I come from. I've heard people saying anyone can analyze a situation based on what he sees, what's the need for investing in mental health. And the list of challenges goes on from lack of knowledge, inaccessibility to stigma. But rather than solely focusing on how complicated the problem is, we focus on how approachable the solution is. And in response, I founded the Changemaker Initiative in 2022 that aims to push the narrative around mental health and merge its links with other SDGs, particularly with SDG 4 and 5. So it's a grassroots led organization focusing on mental health in the South Asian region. We realized that mental health isn't only about service provision, but there are many stressors that might be a risk factor, and in order to comprehensively respond to it, we must look at addressing the multiple underlying factors. And our recent trial of this concept was the Reading Circle project, which used comic books and storytelling to shift negative attitudes around gender equality, educate the impact of violence and mental health in South Asia. And it reached 80 students across India, Bangladesh, and Nepal, receiving a positive response from the readers as being an engaging way of learning. And with that, and following that, our current project also focuses on providing online counseling to survivors of trauma and violence. Our approach as a youth-led initiative has been majorly focused on collaboration with other stakeholders, specifically with other youth-led initiatives. We put our emphasis more broadly across the region rather than pinpointing the country itself, since we know that the challenges are culturally shared among all countries in South Asia. And as we understand that large physical activities can trigger a safety concern for our advocacy work, we function at a grassroots level and share the divide between on-ground and digital advocacy, which is one of the main ways we can try reaching out in this context since it's difficult to reach physically. And on the other hand, we value the power and knowledge that lived experiences hold, since they not only allow us to contextualize our programs, but also to use it as a resource for storytelling. And while I come towards the end of my response, I would like to emphasize that mental health is a universal issue and it impacts everybody, and also to emphasize on the importance of having global convenings like the annual meeting, which really gives us a valuable opportunity to rethink and re-envision the future of mental health and bringing in innovative solutions and catalyzing change. So I really hope that the cycle continues in the long run, and thank you so much.
Thank you very much, Ahmad, and thank you for highlighting that mental health should be everyone's business, whether you come from a young population or other communities, especially even in conflict areas. Mental health is indeed a need, and we hear you, we feel you. We hope you could join us today, but thank you very much for sharing your reflections with us. We now go with another representative of young people through Marganta. So Marganta, how can early interventions and proactive mental health education make a difference in the lives of young people?
Yes.
Happy to hear your thoughts.
Thank you, Ives, and I'm just very honored to be here. And thank you, everyone, for the opportunity. My name is Gian, and I'm from Indonesia. I'm representing my nonprofit, Emancipate Indonesia, which is focusing on workers' rights, especially for young workers and its relation to mental well-being, and as well as here also being a part of the council member of Being Initiative. But before we go into what Being Initiative is, maybe I would like to address the question, why is early education and interventions basically really meaningful, in this case to improve the mental well-being of young people because coming from a person, this is the first time ever I said this in public, and I think if there's any safe space, then this is it. I'm a person with lived experience as well, with adverse childhood experience. I experienced domestic violence when I was 8 to 9 years old. Even though it happened just once, twice, or 3 times, but then the effect was throughout my life, right? Can you imagine that with years of therapy and everything? But then this makes me wonder as well, what if in parts of my life there was someone who can approach me and say it's okay not to be okay, and you can be also part of the solution of the challenges that you're facing on a daily life, on a daily basis. Someone that can trust me and also like to educate me with facing stigma and everything that we've been talking about in this session. So this is actually why I believe that early education is very important, because we put young people and children, adolescents, not only beneficiaries of the program, but they're at the heart of the program, which means that we are not engaging them in a decorative or manipulative, tokenistic way, but also we invite them in conversation. And also not only the young people themselves, but also the enabling environments around them, their community, their schools, and everything. And this is why I'm very proud actually to be a part of Being Initiative, because Being Initiative actually is an initiative that supports all of those things. Young people, actually we are building consensus and conversations, not only with young people, but also their environments in schools, in communities. So we open conversations, and actually I think that in order for Being Initiative has to basically to focus on promotion and prevention as well, because as we know, the global mental health fundings for mental health services, mostly by national governments, fall under 2%, and most of them are only for crisis events and humanitarian settings. So basically promotion and preventions are very much underfunded and undersourced, and even underlearned in a way that we also need to learn the context, because especially in my country, Indonesia, and other low middle income countries, we have specific contexts that one saying that I always love is there's no one size fits all, right? Has to be tailored to the certain context in order for us to support the mental well-being of young people in this context. So basically for promotion and prevention, of course, we need to learn first the context of basically the conditions. And this is why Being Initiative goes in 3 ways, which is learn, invest, and mobilize. But first and foremost, we don't invest, we don't mobilize, we learn first. Because who knows the best solutions rather than the local communities themselves and the young people and adolescents themselves. Maybe perhaps there are many Gians out there, right? Like having like similar or same lived experience as me. And they want to be a part of the solution as well, part of the conversation as well, not only as tokens in, basically in our reports to donors, which I think brings me to my last conclusion as well. I don't want to linger too much. This is just amazing, the panel and everything. But I think we cannot solve mental health problems only by addressing the taboo, the taboo stigma of the mental health as an issue, but also solving it by overcoming the taboo and the stigma of us who are working in mental health issues. In development sector, in health sector, cross-sectorial sectors, we need to go beyond the business as usual. We need to go further. We need to break the glass ceilings. We can't do just the way we did it for the past many years. I think Einstein once said, if you expect different results by doing the same things over and over again, you won't get it, right? So I think this is why dialogues like this are very important for us to actually go beyond the business as usuals. For instance, if you're involving young people, basically letting them know firsthand, this is how we're going to involve you, this is how the follow-up is going to be, this is how you're going to be compensated, well compensated, and basically this is how you're going to be respected, and this is how you're going to have safe space. So basically something that is taken with good care will also have sustainable basically solutions in the foremost. So we're going for a long run. It's not a sprint, it's a marathon. And I think that's why we're all here. We're going for the long run, and I'm very happy to be a part of the process through my community, and also everyone here. I'm looking forward to hear more from everyone here. Maybe that's from me. Thank you very much.
Thanks so much for that, Gian. And I appreciate and I thank you for opening up and acknowledging that this is a safe space for sharing your lived experience with us. And I'm very touched that you feel open and safe in order to share that with us. And I like your comments at the end saying that it is a marathon. And I just want to highlight that education is continuous and across a lifespan. And when we're doing education program, especially for mental health, it's across the continuous lifespan from early childhood to middle childhood, adolescence, into adulthood, and into older age. And education continues, and we never stop learning. So as long as we continue to grow within this advocacy space, within the research space, we need to also continue our education as well and revamp it to ensure that we are constantly given the accurate information so that we can ensure that all of our advocacy, all of our research is well informed. Now, I want to talk to Juliana from the Americas, my counterpart. Now, you have extensive experience within the civil society space, and I want to know more about your coalition building within Brazil, and how has that been supporting the advocacy efforts?
Okay, thank you, Stephanie. And I've been united in a global mental health community that are in this room or around the world. I'm sure that all of us are heart and mind connected, because this is a not easy theme to be involved to. It's an honor for me to be representing the advisory board here and bring this initiative, the Brazilian coalition, that I would like to share, but I'm aiming to also learn from all of you, because advocacy for change is a continuous learning experience, isn't it? Well, I don't know if you know, but Brazil is learned as a very happy, live country. But in the last few years, WHO and PAHO just put us on the top of anxiety, depression. And a national data recently launched told us that in the last 20 years, self-harm doubled. And 20 years is when we started our NGO in Brazil, promoting early intervention, promotion, mental health, life skills connected with the evidence-based methodologies that are in 30 countries. And when we started there in 2003, mental health is a word that we could not talk in the schools environment. So the stigma, I think that's the word that I most heard in these last hours, is something very tough in our Latin American culture as well. So very briefly, what happened with why we decided to make a coalition? Because ASEC works, there's a fantastic work, but Brazil is a huge 200,000 million people. So we are alone in the matter. Then I met Beto. We got together for the UNICEF protocol analysis in Brazil for our context. And then we got together to another organization, and we realized that we are not going anywhere if we're alone. So taking the experience of United Global Mental Health, we said, okay, there is an agenda to be addressed, and we must get together to be stronger, to try to articulate, because Brazil has a lot of policies, initiatives, but they are always spread, they are not connected, and the government, the public, the private sector philanthropy that is very rich, they put a lot of money on education, but they are spread. So we felt that there is a huge job to be done. So in 2022, we received a small grant for design our theory of change. That's what we have been doing in the last few months, and we now have an identity we will call Vertentes. We will be launching a call of action in October that's going to call Mental Health for Tomorrow. It's going to be in a huge venue in Rio de Janeiro. That's the Tomorrow Museum. That's very beautiful. We received as a grant. And we decided to start with the basic literacy, launching Language Matters in Mental Health campaign that will be spread in many, many different channels. And we think that starting with the basic, how you communicate with each other, how to link, how to avoid stigma, discrimination. So I think this is the first hand, but we will have a call of actions because we came for nurture mental health culture changing by actions. So innovation, Beto, we have a case in this afternoon. If you want to learn more about this, we will explain in details. So it's a pleasure. We want to engage in all actions that it could be possible, and we want to share and learn also from you. Thank you so much for the opportunity.
Wow. Thank you very much, Juliana, for such an inspiring story around coalition building. And we're very much excited with what's happening in Rio de Janeiro with the mental health for tomorrow and the emphasis on the value of right language around mental health.
I just learned yesterday from Sara that we have G20 next year. She really told us, and we have a huge agenda. I would like to learn from India and Indonesia as well. So we have a lot to do. So hope
Please
to
connect with Juliana. We look forward to these connections among our national partners, and that's the very reason we are gathered today. It was one of the key things that hopefully we can take with us before we get home. Wow, that's been a lot of insights coming from our range of experts from global perspective to grassroots level advocacy and even youth representation, youth in action indeed. So I think we have heard all these inputs, and I wonder if we have any burning questions or comments from our participants, including our virtual audience.
If you have a question for any of our panelists, please raise your hand and we'll have a mic come to you.
Yes.
We have one question in the corner.
Thank you. So nice to get to see all of you here. My name is Damien. I'm from Kenya. Damien Jomo. So, in summary of what I just heard you all say is education is important. Everyone, from March to the last speaker, Majianta, and also the online participant. And I'm wondering, we might be here speaking a lot about what we wish would have been done. But if our countries and our ministers of health and our presidents are not prioritizing the policies that they sign on to, the agreements, the reports from WHO, for instance, then it pans the question around which direction of travel are we willing or hoping to travel to. And I think my question goes to you, Mott, from WHO. When you have these meetings with the ministers of health or the presidents, how much on mental health is spoken about, one? And two, I wonder whether you assess the knowledge or how much they are familiar with the WHO reports. For instance, the report that you launched, I think, was it this year? Was amazing. But how much of that do they know? And how much of that recommendations are they going to take up? How much, can we just be a little bit honest about how much we are putting out and how much is being consumed or how much is being taken up? Because it would be a shame for us to meet up here again in 10 years' time. And the same recommendations that we did in 2023, we'll be recommending them in 2033. So first of all, that question to you, Mott. And second, I really appreciate what Majianta said. around the Bing initiative on learning, investing, and mobilizing. And I want to emphasize on the learning bit. Also, for the young folks who are doing so much work in the mental health landscape, which I deeply appreciate, and I'm grateful for, especially and the lessons learned from the United for Global webinars and all. My question to you is, how best do we find strategy? I was speaking to a friend of mine earlier on today, and the conversation was around mostly funding. But I think how best do we stop lamenting, or maybe complaining, or maybe blaming funds as young folks, and how best do we build strategy to ensure that whatever we're doing or whatever we're asking to do is directly inviting funding instead, so that we tackle the problem of funding from the other angle. We don't have money, but this is what we have. Who is willing to support? Thank you.
Great.
Thank you so much for your questions. So we had two sets of questions, so I'm going to ask Mark first to address with how do we educate our ministers of health and presidents.
It's a fantastic question, Damien. Thank you so much. I do not think any president of the world will have read the World Mental Health Report. I mean, I don't think so. When we conceptualized the report, very much Melvin Freeman here, who played a huge role in the conceptualization and the drafting of the report, we said, well, it's for leaders in mental health. And yes, ideally, we work in the health sector, it would be the Minister of Health. But even the Minister of Health is not going to read the whole report like that. So it's likely the people that are reporting to an influence in the sphere around big decision makers that may read aspects of the report. Not cover to cover would be great. I hope so, but I'm not sure that will happen. And they bring their messages up to the bigger decision makers. So I think that's how it goes. In terms of commitment, and in the report we talk about 3 levels of commitment: political commitment, then institutional commitment, meaning policies and all that, and then financial commitment. And generally, the idea is that goes into certain order. So we're at a time where mental health is getting some political commitment. Many of our political leaders are interested in talking about mental health. And they're willing to maybe go towards policies and directions in that area, but usually without a budget attached to it. And so this is my answer to your question of what's real and what's not real. What's real is that there is an interest among leaders to do something for mental health and to talk about mental health. What's not real is that right now there is a commitment out there for people to really change their budget allocation in a significant way. But there's a process, and I think meetings like this, and we all together, can have an influence on that.
Thank you so much, Mark. And if I might add, when it comes to educating some of our higher up decision makers within the government, what my organization, like Healthy Caribbean Coalition, what we do is that we create like these one-pager key messages of what policymakers need to know. Because you're not going to read, as you say, a 30-page document. They don't have physically, they don't have the time to read these documents for every single health issue that might occur. So what has been really helpful, at least for us in the Caribbean, is creating these one-pager documents that just have the key messages that we want them to know. And sometimes we create these policy briefs as well, that maximum 2 pages, because that's all they have the concentration for. And through those various one-page documents, maybe 2-page documents, some of it might get to them, and then they will be able to know what are the key things they should know about mental health, or what is the key policy that we want them to implement. So when you're doing your messaging, when you're doing your advocating, I will suggest maybe some stuff like that, like key messages, one-page documents, when you want to get it to your higher-up decision makers as well, that condense the information that's from these WHO reports. Gian, he also had a question towards you about financing and how do we strategize for that?
Yes, thank you for the question. I think it's kind of like elephant in the room among youth communities. We have all the tools, all the experience, and how do we do it right? And how do we gain access to those like proposals, etc. I think it just coming back to like being as well as now we are speaking, being is now also like working with the Science for Africa Foundation to actually, and also our country partners to analyze systemic factors actually, and then we will find the underlying basically issues regarding mental health on what to fund basically, and then early next year 2024 we will expect to release the request for proposals for especially in our 13 priority countries, and maybe some of you, if you're included in priority countries, also can propose in that. But I think coming back just to your main idea among youth communities, us as horizontally, like among communities, I think it is also important for us to make sure that first is follow-ups, right? Sometimes you're invited to certain events and we expect there is something follow-ups, but there is not always follow-ups. Let's be honest about it, right? Oh yeah, we will bring your voice and something somewhere, and then it just ends there, right? It's just a thank you email and that's it. It's just a single social media post, donors feeling good about themselves, and that's it. So we as young people need to demand more about that. Sometimes we need to chase them, we need to send emails, we need to, even sometimes in my case, in other issues other than mental health, I worked also in tobacco control for years as well, with all the risk fighting giant corporations. Basically, sometimes we have to do it ourselves first. We initiate certain training, certain research, even though people will stigmatize us, young people don't have the experience. Well, we don't. We offer the future. We offer what's not there yet, right? And that's where we come in. And then sometimes we do it with our own resources. Despite all the flaws, just do it first. And then sometimes they will notice, oh, actually you can do it. It's doable. It's on something, oh, maybe we can invite us. So maybe sometimes it takes extra initiative from our side, sadly. And I know not everyone and every youth community has the privilege to do that as well. But I think it's one of the cases that from my side as well, from my end, from my experience. And I think maybe can I add into the first question? It's my burning question for me. How do we educate powerful people, right? We don't. We don't educate them, we push them, we pressure them, we shout at them. Because we're talking about, I'm sorry, just to be honest, I was trying to be calm, but when we talk about politicians, powerful people, people with resources, fiscal powers, authorities, funded by our tax money basically, they should serve the public, the many, not the few. And we are talking sadly about certain kind of people who love themselves more than anyone else. So what we do, actually, from my experience working in workers' rights issue, working in tobacco control issue, we find out what they want and where our wants meet. Sometimes they want stage, they want credit, give it. So sometimes we launch it in a public space. We make certain shadow puppet show and something, and then, oh, then you will give the big speech here. Even though that particular person didn't help us at any time. But then we gain access to not the person, their staffs, right? Their right-hand man, right-hand women, etc. And then we contact them, follow up, and then we push them, can we have another meeting? Can we have another meeting? If that doesn't work, me and my network in the past, we text bomb them. We spread their numbers. It's like, okay, you're a representative for people, can we, blah, blah, blah. That doesn't work as well. We shame them in the public. We use memes, internet memes, viral videos, content creators, come aboard. Young people, you're best at this. Pressure them. If they don't do something, they'll feel ashamed and their approval rate is going down. And they want to win in the next election. We're talking about millions of registered voters. You want them to lose, you. So sometimes we also have to be idealistic, also pragmatic in a way, and also tactical sometimes. So, and even that means like barging them at the toilet, and I did that. They were just washing their hands. Sorry, here's the 2-pagers. I combined my answer with stuff. Here's the 2-pagers, sir, and thank you very much. And maybe you can contact us at any time. We met before. You don't remember us, and I know you don't, but anyway. So not only we have to educate them, but sometimes with campaign, with advocacy, what is the best method? Every method's possible. Every method's legally possible. Because sometimes it means also like disturbing the status quo if we want to basically create something out of it. So maybe that's from myself, but also at the same time, this is I'm sorry it becomes long, but this is why in my Tobacco Control Alliance we also, inspired by the UNICEF Safe Protocol for youth engagement as well in mental well-being, when you do all of these things, pressuring powerful people, don't forget your own mental well-being, because sometimes activists, climate activists, working rights activists, I work with unions, etc., and sometimes it's just so overwhelming, and take time off and even make a protocol for it, like schedule it, okay, this month we have a collective counseling together at something. It really matters, and also this is a message for all stakeholders and funders as well, not only pushing young people to engage, but also making sure they have the space, which I really appreciate. G-Man has a quiet space. It's a very simple, basically, facility, but it's wonderful that people can have a moment with themselves and just excuse from the crowd. Those little things matter, especially for young people. So, so that's my question. Push and push. We don't educate, we push them. But also, don't forget to have some time for yourself as well to take care of your mental well-being.
Great. Thank you so much, Gian. So we have some practical, tactical ways in which you can educate. So let's be sure that we educate them, be tactical, and sometimes it's not necessarily the main decision maker, but sometimes the persons around them in which you can educate to get the influence. We have another question at the front, and then we have a couple on.
We have a couple of questions here.
We actually, maybe we could go to one from our online audience.
Sure,
really quickly,
yes.
just to make sure that their voice is in the room as well. And this question is actually for Ahmed on how can we better support MHPSS in humanitarian crisis and people who are living in conflict settings.
Thank you so much for your question. What we have been doing from my personal experience is, because I live in exile in Australia, and what we have been doing, one strategy that we are using is pushing humanitarian donors and international donors like the Australian government. Recently we have been liaising with the Department of Health and with the government of Australia to provide mental health support as part of their humanitarian assistance. And that's one aspect that we are doing, in which we are pushing international donors to integrate mental health services as part of their commitment, because in humanitarian contexts and in conflict zones, that's the only possible way where we can redirect those funds to priority issues like mental health. So that's one way of doing it. But then another way, which we have used, is providing online counseling based on the funds that we are receiving. Again, it's from international donors, and providing online counseling, especially in tough times when people are going through a lot, and in these times, considering the impact that it leaves on vulnerable population, it's too much for them to bear, because, as I said in my response previously, that it's discrimination, bullying, and that they face, and a lot of, I would say, domestic violence, like the recent ban on girls' education, or in general, the violence that vulnerable population face in conflict zones. It really makes it a necessity to provide mental health services. And the basic ways of doing it is through digital advocacy, because right now, it's quite, and I think it resonates with all contexts, whether in which there is conflict, because it's unapproachable to physically go there and conduct programs. So digital advocacy and online programs are the best way to reach them. That's one thing, but then the other thing is also to push donors to integrate that service, and also to find collaborators and other organizations who are doing groundwork to provide those services. So it comes with collaboration and leveraging ways which works best in every different context.
Thank you very much, Ahmad. That was well said. And yes, to another question, please.
Good morning. I work for an organization that is called POLA. We are one of these organizations that are supported by Empower. Our work is about advancing Afrocentric, culturally sensitive methodologies that are co-developed with communities affected by trauma. And we talk about how collaborating and learning from communities can be very effective in responding to the effects of hardships. I want to pose a question in relation to stigma and discrimination. Some of the things that we've learned working with communities is that unless they are able to understand and embody and make meaning of what is going on in their lives in culturally sensitive and relevant ways, they continue to push back against mental health services. And so I want to, ask the question that do you think that the lack of embracing indigenous knowledges and community knowledges in responding to trauma and hardships can in actual fact perpetuate stigma and can make it more impossible or difficult for communities to access mental health services, because sometimes they just don't feel that services available speak to what is important to them, what fits for them culturally. And so I think my question and my contribution is really trying to bring forth this idea that indigenous and culturally sensitive ways of responding to mental health are key, and that as part of advancing mental health for all, we need to be understanding, what we need to be doing better in order to increase access and to reduce stigma. So thank you.
Thank you. Great. Perhaps Sandra would like to answer that question?
I would, actually. I think it's a very important point to bring up is the cultural differences within stigma. You just reminded me of something I actually read recently about the literacy crisis in South Africa and how the majority, I think it's over 80% of grade 4 learners can't read for meaning. And when I read this article, I actually self-reflected on it a bit in terms of mental health language. Firstly, a lot of the language, obviously, relevant to this point is communicated in English, which is a problem culturally, especially in Africa and South Africa. But I think at a core, what I thought was it's not always what is said, but how it is said and the intention or lack of understanding behind it. That's the most important. And I think we just need to try and strip it down and make it very basic. And then, the cultural differences and stuff. So we basically start on a tabula rasa, basically a blank page, where we all come from the same place in terms of language and the way we approach things. I'm not sure if that quite answers your question, but I do appreciate the question, and it's very important to note cultural changes or differences in mental health and the stigma attached to that.
Thank you very much, Sandra. The concept of tabula rasa. Further add on the point, Juliana, please.
Yes. In fact, oops. Are you hearing me?
Oh, yes.
Yeah, I really believe that literacy, learning how is the meaning of feelings, how one nurtures self-respect. And this is a long-run work, but we have in our 20 years of experience in Brazil dealing with vulnerable communities, most African descendants, and those one who suffer more in the system. We learn that if a child or a youth is on a track of evidence-based learning their skills for life and understanding their context, and despite this context, they grow their self-esteem and their self-respect and a lot of skills that make them detach this suffering context and see, okay, I have a chance. Despite my father is in prison, my mom is a drug dealer, and I could have another future. So I think that we have a lot of indigenous suicide in Brazil. We have each 23 minutes a youth, a black youth is murdered. And we are trying to change this, but it's a long run, and I believe in this literacy could be, despite the trauma, but for everybody, we need to invest in the long run literacy. Thank you.
Thank you very much, Juliana.
We have such a great panel, so much discussion, but due to time, we only have time for one more question. So if anybody has a burning question, they must ask the audience, the panelists.
Oh, we already have one.
We already have one?
Morning. My name is Anil Patil. I'm the founder of Carers Worldwide. It was an inspiring opening session. Thank you so much for such an engaging and inspiring session. I have a comment and a question. One is none of the panel member has touched upon, or even the virtual panelist, is the role of caregivers. It is so vital that whatever you talked about, whether it is individual or lived experience and all, caregivers plays a significant role in terms of rehabilitation, in terms of integrating into the family, back into the work, into the society and all. But they are sacrificing quite a lot because of caring role. And it is having huge impact on their own health and well-being. They feel lonely, they feel isolated. You talked about stigma and discrimination, how important their role is to overcome those challenges and difficulties they feel. Nobody has put an application wanting to become a caregiver. They have risen to the challenge, but it is time to recognize the critical role they are playing day in, day out. And coming to the advocacy as well, they play a significant role as well in terms of, so your voice will be amplified further if we include caregivers along with your cause and try to understand their issues, their challenges, their difficulties. Quite often we, as development worker or social workers or professionals, sometimes we label caregivers as they are the one barriers. Are they real the barriers, or is it our inability to understand the bigger picture? Why they are not coming? Because there is no food in the family. They have to go to work, earn an income to support the family. That is the reason they are locking that. So immediately, without understanding, without having that experience, suddenly we label them. So my request and suggestion would be, please spend some time with the family member who is caring them, trying to understand from their point of view before labeling, making them feel not recognizing, not appreciating, or acknowledging the wonderful role day in, day out they are playing. Anybody interested in the family caregivers issue? We have been working on this issue for last 8-9 years in India, Nepal, and Bangladesh. Very happy to share that. Thank you so much.
Thank you very much for sharing your thoughts on the importance of caregivers. Steph, how do we round up the discussions from this morning? Wow, a lot of inputs indeed.
So much important points have been brought up, and I'm really glad you did bring up the importance of caregivers as well. So just to summarize some of the conversations, some of the key points have been brought up by our panelists. We heard from Mark about having a unified voice in advocacy and ensuring that we keep our messages at this level and ensuring that we all agree with these messages. And I think that comes up with Aman and Jian's point with education and ensuring that once we educate our persons and ensure that there is knowledge by our decision makers, we can have that unified voice. And I think having all of us within this space right now is a great opportunity to ensure that we are giving the same messages across the globe to ensure that we have those bigger policies will be implemented so that persons like Mark from WHO will be able to hear us.
I hear you.
Loud and clear.
We also heard points about stigma and how it is detrimental, how stigma is actually more detrimental than the diagnosis itself, and that it is a human rights problem. And it's important to address stigma in all its forms, including self-stigma as well as structural stigma when it comes to mental health. Points were also made about the lack of knowledge, as I mentioned, and that mental health is not necessarily involved in the human rights and humanitarian programs, and it's important for us to advocate for those to be included, because we want to be ensured that it is a holistic approach that we address mental health. And I really like the innovative ways in which we can address some of these issues. A man mentions like using comic books, for example, and reading centers. So those are some great ways in which we can increase mental health awareness. We also heard the importance of coalition building, and that, I think, echoes the importance of having a unified voice. And it's important to build coalitions of civil society organizations, as well as with private and UN organizations, as well as other NGOs, to ensure that we do have a unified voice, not only at the national level, but also at the regional and global coalition as well. We also are excited for your call to action. It's going to be offered in October for mental health tomorrow, and the language matters as well. So we're looking forward to October for that. And then finally, we got some mentions from Jan about the importance of education and ensuring that mental health is included throughout the spectrum for both caregivers, for youth, children, adolescents, and older age. There's so much, and I think that was only just a small snippet of everything that's been mentioned, but I'm sure that there are other key takeaways that you would have heard as well. And I just want to ensure that, everyone can be heard, and it's unfortunate that we couldn't get to every single question due to time, but we have over the next two days, if there's any other questions, there's during the breakouts, during the breaks, you can also ask questions to our panelists to ensure that you are heard.
Thank you very much, Stephanie. And if there's only one key takeaway from me, is that whether you're from global, regional, national, or community level stakeholder, no single stakeholder can do it alone. There is strength in number, and I'm so glad that this room is full of compassionate advocates. And please seize the moment to connect with each other in the next 2 days. And at this point, we will now be heading back out to the lobby for a refreshment break. But before that, we'll have some few reminders for you. But please do familiarize yourself with your session choice for the next session. If not, we'd be happy to support you with further information. The list is outside the check-in counters. And as a reminder for this break, these are the following information. For UHC and mental health, an integrated approach, this will take place in the same room where we are in. Then for data and advocacy, addressing data gaps on youth mental health, this will take place in the breakout room, Frisha. And lastly, the National Work Showcase from Argentina, the Caribbean Grassroots Soccer International, is taking place in Daisy. If you're not sure where you have registered, feel free to refer to the list at the registration. Alternatively, you may check the list through the email sent to you last Monday. In the event that the room is full, please feel free to join other sessions. Let us make sure that we welcome good audience across these sessions. Right, staff? And then lastly, for those who are joining us online, we'll be on break for the next 30 minutes, and please feel free to come back for the session on UHC and mental health. We look forward to having you there.